I wonder if you can, as you did in the MAPS conference in 2017, I think you were able to give kind of an overview of the effectiveness of this approach of psychedelic-assisted psychotherapy. Um, can you, because, you know, from the statistics that you were able to present at that time, I think by combining them, I think it came to about 100 and some cases.
Yeah, 105.
Okay.
Yeah, we've done, since that first study that we started in 2004, there have now been 6 phase 2 studies of, individual MDMA-assisted psychotherapy for PTSD. There have been some other ancillary things too, but those are the main studies going toward the FDA approval. And earlier this year, we published the pooled results of the 6 phase 2 studies. Annie and I did 2 of those. One was in Boulder, Colorado, one was in Vancouver, one was in Switzerland, and one was in Israel. So they were different sites, different countries, different teams. And the pooled effect size was large compared to the one thing about our studies that's different from a lot of studies is our control group gets all the same psychotherapy. So it's a placebo control, or in some of these studies, it was a low dose kind of active placebo control. But everybody gets all the same intensive psychotherapy, including the all-day sessions, whether they're randomized to MDMA or to placebo. So we actually saw significant improvements in the placebo group due to all that therapy, but then the improvement in the MDMA group was much greater. So even comparing to the people that got all the therapy, our effect was much greater than, well, the 2 drugs approved for PTSD now are Paxil and Zoloft, and our effect was twice that of Paxil and 3 times that of Zoloft. So
Yeah.
large effect size. And it was based on that data from those 6 phase 2 trials that the FDA gave us permission to go on to do what we're doing now, the phase 3 trials. And they also granted us breakthrough therapy designation, or granted MDMA-assisted psychotherapy breakthrough therapy designation, because the data was so promising and held the possibility of a big advance in the treatment of a life-threatening illness.
So what does that mean, that designation?
It means that the FDA feels that because of the strong effectiveness in phase 2 trials for a life-threatening problem, that they want to expedite the process of doing the phase 3 trials. So it means we still have to do the same phase 3 trials, but we have faster responses from FDA, more access. We can ask for meetings to discuss things that come up to try to move the thing along more quickly. So that's where we are now. We're doing phase 3 trials, and we have 14 sites in North America. 2 of those are in Canada. The rest are all over the U.S., Los Angeles, San Francisco, New York, Boston, Charleston, all around.